Now, it's gone up to 7:10. Hospitals in the North East have spent more than £1.6 million on private MRI scans for patients who are too anxious or too obese to use a regular scanner. This is according to figures obtained by BBC Newcastle under a Freedom of Information request.
MRI, or magnetic resonance imaging, is used to help diagnose a wide range of conditions. But the size of the conventional scanners at hospitals in our region mean that a lot of patients don't fit in those machines, or they find them so claustrophobic they can't relax and then lie still during the procedure, which they need to.
Yeah, that means special open scanners have to be used and paid for instead. BBC Newcastle's Ruth Holliday went along to a private clinic in Newcastle that's been taking an increase in numbers of NHS referrals.
OK, so the table's just going to move and then your first scan's coming up and it's 3.5 minutes.
The sound of a powerful 32-ton magnet producing detailed images from inside a patient's body. The Newcastle Clinic in Jesmond is home to the North East's only open-sided MRI scanner. The lead radiographer here is Liz Story.
It is more designed like two plates so that it's open on all sides. So you can literally just turn the patient's head and they can see light and air, and you can sit a friend or a relative with them.
Most of the patients referred here by the NHS fall into two categories. Either they're too big to fit in a conventional scanner, or they suffer from anxiety or claustrophobia. Shaun, the clinic's managing director, says the balance between those groups is shifting.
When we first started scanning, there was a high proportion of patients who were actually anxious, and I would say about 65% were anxious and 35% were larger. We're seeing a massive shift in that, and it's probably just past the 50-50 mark at the moment, so we're seeing a lot more larger patients coming through.
Do you have patients who are too large to use even this scanner?
We do. Not very many, but we are seeing more and more.
And how big does somebody have to be in order to need this particular type of scanner?
Not very big at all. The diameter of the aperture of a traditional scanner is 60 centimetres. Our scanner actually is 132 centimetres. So you don't have to be very broad not to be able to fit into a conventional scanner at all.
The MRI scanner can help diagnose conditions including spinal, abdominal, joint and head problems. Less than 1% of patients refuse to go through with their scan here, compared to an estimated 10% or more in conventional machines.
Most of the patients that come to us have actually failed a scan on a conventional scanner due to either not being able to fit into the scanner or just couldn't go through with it and complete the scan. On the whole, 80% of the patients that come to us have actually had an appointment and failed a scan within the NHS Trust.
Figures obtained by BBC Newcastle under Freedom of Information suggest the 6 NHS trusts in our region have spent more than £1.6 million on these private open MRI scans over the past 3 years, with Sunderland accounting for more than £1 million of that total. Northumbria NHS Trust comes next, with around £415,000, but a new, bigger scanner at one of their hospitals is reducing demand from its larger patients, although those with anxiety are still referred here. Managing Director Shaun says the costs of this private service and NHS scans are not widely different.
We work to NHS best practice tariff pricing as best we can. In the NHS, for a similar type of scan, you'd be looking at £299. Our price is between £350 and £375.
But pricing can vary depending on the patient's condition, and the Sunderland Trust says it's paying an average of £500 per scan. The more complex and difficult the scan, the more expensive it is, and lead radiographer Liz says many of the cases they deal with here are far from straightforward.
This is the last stand for some patients. They can't cope with a normal MR, and there isn't an alternative to give them a diagnosis. So we somehow manage to get some information so they can be diagnosed and treated.
So that's our reporter Ruth Holliday there at that private clinic. And if you've had to be scanned at one of our hospitals, what was it like? Maybe you were too anxious to go through with it, had to use one of these special scanners, or even had to be sedated for the procedure. Let us know how you felt about it. Text 81333. Make sure you start that message BBC. But as I've said, many people have to use these open scanners because of their size. Let's speak to Tam Fry from the National Obesity Forum. Morning, Tam.
Good morning to you.
Should NHS hospitals be investing in some of these scanners for themselves?
In my view, they should, but perhaps not every hospital needs it. Certainly within a region, there needs to be one of these machines. And I'm very struck by the amount that it's costing the NHS to go private.
Yeah, £500 a pop for a scan.
Well, yeah, the scanners themselves cost £1 million each upwards, and therefore if you do the figures and you regard getting a scanner as an investment, it will probably pay for itself within a 10-year lifespan. And believe you me, we're going to need these scanners more in the future. I mean, the gentleman was talking about a 50-50 split. Now I think within 10 years you're going to see something like a 75-25 split.
But when we're talking about the financial side of things and the investment over 10 years, shouldn't the patients themselves be making a contribution?
I think that the principle of the NHS is that you get treatment free at the point of delivery. And I think it would be very difficult, perhaps, to establish a price which you could reasonably ask any patient to pay. I think that the responsibility is actually on the NHS to provide the equipment, the NHS fully knowing that if they do that, they will probably be able to amortize it over a period of time, and therefore, in a sense, it'll pay for itself.
But many people argue that the demands on the NHS are increasing for many reasons. One, of course, is our elderly population. You can't help it if you're living for longer. However, the rising obesity problem, it's like an epidemic, and in many cases, it is just simply down to overeating. So don't some people need to take responsibility for themselves?
It has to be said that everybody has to have responsibility in the sense that they are the sole people who can govern how much they eat and how much they exercise. But I'm afraid that I have a great deal of sympathy for a lot of people who are now obese because they were not properly helped and advised when they were progressing towards obesity. And if you will, therefore, the penalty has to rest with the people who didn't do that, and in many cases that is the NHS. Today there's a new report out on the British Medical Association website bemoaning the fact that there is a total lack of facilities in some areas of the country for people who are putting on a lot of weight to be helped at a time where they could actually do something drastic in terms of bringing them down to a regular size. If they're not helped, they will just continue to get larger and larger and larger. And that, in the end, is terrible because it'll mean that they acquire the diseases which are far, far, far more expensive in the long run because they usually lifelong treatment and in some cases might actually lead to premature death.
Thank you, Tam. Tam Fry from the National Obesity Forum.